Hello everyone, this is Khizr Hayat, the CTO of Rig Basket, and today we're going to discuss a case study with regards to hospitals or the healthcare industry and see how the supply chain is actually very important in the healthcare sector as well. So to start off, we have a simple Excel file, which is a database for the hospital, and it has various information, location of the hospital, the names, zip codes, wards, material replenished code, patient age, ethnicity, health issue, all the information that is somewhat critical to just solving the supply chain problem. So we begin our analysis. So we first start off with our top-down approach. So the first layer is the highest layer, which is just looking at the total costs. And we have some summary statistics, the number of different hospital locations, the total cost that they spent over the last year, 2016, the number of suppliers they use, and the number of distinct ethnicities that they've been treating. And then you have a very interesting chart here. There's different bins for the age group. So there's 0 to patient age 0 to 5, 5 to 9, or 0 to 4, 5 to 9, and then 10 to 14, and so on and so forth. So one of the very interesting parts here is that all the ethnicities in each bracket seem to be pretty evenly spread out. I mean, you can kind of see maybe there's a little bit more other ethnicities versus native, but it's not significant enough to see. But the dispersion is pretty similar across the entire spectrum. But one of the points that's very interesting here is your total cost for people in the 75 to 79 age bracket is really low. But the average cost is really high. That means per person, the cost is really high for this particular hospital, or this the hospital network. Now this is a very interesting insight. So anyone between 75 and 79 years of age that comes in, the expected average cost is pretty high, and that's not very surprising because older people generally require more healthcare. So it's something that kind of affirms the what we had thought. And again, just to let you know, this is all dummy data and it's all made up data, so it's not really a real life scenario, but still, this is a really important point to notice. Also, another important point to notice is that between 0 and 4 years of age, there's less people compared to the other age brackets, which also makes a little bit of sense, because younger children don't really get sick as much as older people do. Yes. Now we have a total cost across the entire spectrum, and we have the costing across Q1, Q2, Q3, and Q4 for the 5 different hospital locations. So what we can see is this particular location, which is location number 1, the cost seems to be going down. And as you click on it, you actually see how the cost in this particular area is varying as well. So this is another very interesting insight, because it shows that even though all the other ones, well, 3 of the other ones have varying costs, number 1 seems to be managing their costs really well. So maybe we can learn something from number 1. Now if we dig in a little bit deeper here, month to month, we can actually see how the different costs vary across the different locations. And it seems like there's a few outliers, especially in this particular location, which is location number 2. So it has a point above and a point below the percentile. So what's going on here? Why did the cost go so high up in July when they were so low in May? What was going on here? Why haven't they been able to manage their costs that well? What can they learn from number one? Because number one seemed to start off at a really high rate, but then their fluctuations became somewhat predictable, and they followed somewhat of a nice pattern. Again, number 4 has some outliers as well, just one outlier, but it's also fluctuating quite a lot. Number 5, the average actually seems to be pretty low for number 5. They have an outlier, but this is a good outlier. So maybe we can learn something from these guys, because they seem to be managing their costs pretty well and following a somewhat predictable pattern. But we know that there needs to be something done with number 2 because it has the highest variance as far as cost is concerned. And we need to look into this deeper and perhaps learn from number 5 to improve costs in number 2. And again, you kind of get to see how the total cost went across the whole year. So 32K for 1, 33 for 2, for number 3 it was 33, 4, 5. And 5 was 31K, which is a little bit less than the other one. So the total cost across a year for all of them seem to be pretty similar, but we need to control this variation so we can plan better and we can organize our budget accordingly. So now let's dig a little bit deeper into our costs, looking at the materials. So we have a replenish cost by quarter and by location. We have our costing cube, which basically shows us all the items we use, along with the quantity used over the year, and then the total replenishment cost. Now we can see immediately that wristbands is red, which means that the replenishing cost for these was really high. Even though the quantity used was similar to the other ones, it's really expensive to replenish a wristband. So immediately our attention goes here. And if we click here, we can kind of see how the cost or the quantity used varied across each month, and then how the cost varied per location. So it seems like location number 3, after Q1 and Q2, the cost for wristbands was actually pretty low for these guys. So they must have implemented some sort of a process improvement that we can learn of. And then it seems like location number 4, the wristband cost kept going up. And number 1 seems to be doing a good job of reducing cost at the same time. So looking at it a little bit deeper, so this is a big anomaly. Why did cost in May at location 3 go so low? So another insight we derived from this particular chart. And the other stuff seems to be pretty smooth here, except this point here and then maybe this one over here. But number 3 seems to be managing its wristband cost really well. So where are our costs coming from? And it seems like number 4 and number 2 have higher costs for wristbands for replenishment. So these are the areas we need to look at to actually bring the cost down and maybe learn from number 3. Maybe they struck a deal with suppliers. And just to let you know that there's only one supplier per part in this particular area. Also, it's pretty interesting that there's actually a pretty high variation in the quantity used of the wristbands over the year 2016. So why is the variation so high? Is it really the patients? Or is it more that we're not managing this properly across the entire spectrum? And again, maybe we can look at number 3 and figure out how exactly to improve, because they seem to have at least the wristband costing in order. And this is the one with our highest replenishment cost. And the average number of replenishment days seem to be pretty similar across the entire spectrum. So we're doing a pretty good job of maintaining, replacing the items, but not at managing our costs. So this is a very interesting insight of where we can save our costs. And then diapers is the next one. So once we are done with wristbands, then diapers is going to be our next bottleneck, where there's a cost-cutting opportunity. Now let's move on to the material quantity analysis. So here we can kind of see the total quantity used, and then it's gives a breakdown by the ethnicity as well. So we used about 19,000 total amount of material in the past year. And then wristbands, it doesn't seem like we use more or less than anything else. Seems like Native Americans use less wristbands than, say, Hispanics, but the number is not significant enough to actually make any conclusion. So these are pretty evenly spread out, and because this is a dummy data set, it doesn't mimic real life scenarios, but this sort of an analysis can kind of confirm that wristbands are your bottleneck from a cost perspective, but not really a quantity perspective, because nothing really stands out from pure quantity perspective right here. And then quantity by patient age and material type. So it doesn't seem like a certain age group uses a certain type of material more than anything else. So we can't really make any predictions there either. What we can say is that between 0 and 4 years of age, less material is used. But we also knew earlier that their cost was less. So if you're between 0 and 4 years of age, if your patient is between 0 and 4 years of age, a lot less material will be used. And same story for between 75 and 79 years of age. But we're getting less people there, but their average cost is very high. So these are some interesting insights that we can find out. Lastly, we can kind of relate diseases to ethnicities and patient age groups, as well as the total cost, to see if we can maybe start making any predictions. So from this particular chart, you see some fat spots, which means, say, for checkup, the other ethnicities between the age of 0 and 20 seem to have a slightly higher cost compared to people who are between 25 to 45 years of age. So this again can be a decent prediction as to how to plan your budget based on a costing, based on the ethnicity that comes in and their age group. There's no significant anomalies here. I mean, there's maybe one anomaly in this spot for leukemia, where between 0 and seems like 4 years of age, there's a big cost in the other category, but it suddenly dips down. So maybe this is something we can look at and make a decent prediction as well. And so they're pretty evenly spread out. There's no major gaps here that we can actually make any useful predictions from. But again, this is dummy data, so that's why we can't make any useful predictions. So now we know that our bottleneck is wristbands, and that our bottleneck as far as the age group is concerned is 75 to 79 years of age, because they have the high average cost. So let's look at wristbands for a minute. We want to figure out what our optimal stocking level is, because we know how much we used last year, and we have data to kind of see if how bad the variation was. And if it truly is somewhere where we should look at. Because here it seems like it varies quite a bit, but again, there's only 1 point outside the percentile line, which might not be too bad. So how do we dig into this deeper? So let's go into export data. Material quantity save. All right. So now I'm going to open up this file. Desktop client data set, hospitals, I believe I have it in there, analysis and material quantity.csv. Cool, huh? So we just pulled out information real time to do some more analysis on it if we want to. Now we already have our dashboard there, but it allows you to pull data out so you can analyze it more, and it's all in chronological order. So now we move over to the RigBasket app. If you remember this app, it's to figure out how much to order and whether our inventory is in control or not. Basically, whether we can predict how much we are going to need at a certain moment in time, or if it's all over the place. So let's go to Choose File, Hospital Insights, and All Files. Where did that go? Hospital, oops, it's an analysis, sorry. Material quantity.csv, incorporate, and I want to look at quantities. So wow, we're in control. There are possible ways to further reduce the variation, but it's well in control. our mean is 89 and our standard deviation is roughly 12. So let's enter the average. The standard deviation is 12. And let's say the cost is 300. I'm being lazy and not looking at the cost we had in the sheet, but that's okay. And now we can simulate what the effect would be of reducing our variation, basically improving our processes to make this more make it more predictable. How much cash can I free up? So ideal stocking level 113, and you can save this much, and this is again monthly, I believe, by reducing your variance to 5, and then this much in additional carrying costs, which includes storage costs, logistic costs, and some other costs that were based on our research. So this is the end-to-end platform, and our analysis took about 15 minutes, which would normally take months, to figure out process bottlenecks, ways to improve, where to improve, and where are learning opportunities. And this is only a teaser of the Rigged Basket platform. We have a lot more to offer from a predictive and prescriptive modeling perspective, and would love to show you further details if you're interested. Thank you very much for your time, and we would love your feedback. Bye-bye.